And we are now live.
All right, welcome back. This is Senate Health and Welfare. It is January 19th, and we are joined by our healthcare advocate for the state of Vermont, Michael Fisher. Welcome.
Thank you.
Before we have you introduce yourself for the record, we'll go around and have folks introduce themselves for you. So you know me, because I'm Virginia Lyons. Yeah, but once or twice. And
Terry Williams, Senator from Rutland County.
Hello.
Your senator. Hello, I'm Martine LaRock Gulick, also known as Senator Gulick. I guess the middle part's been dropped. And I live in Burlington and I represent Chittenden Central. Nice to meet you.
Good morning, David Wade, Senator of Rutland County and Company Proctor. Nice to meet you.
terrific. Thank you for being here. You know, the healthcare advocate sometimes is this unknown magical entity out there. It would be great for you to introduce yourself and then your office and your relationship to us and the executive branch and everything.
So good morning, Senators. Mike Fisher. And yes, I have this title of Chief Healthcare Advocate. And just for the one who's been around long enough, I blame Paul Poirier for that.
Yeah, that's true.
I live in Lincoln, and yes, Senator Hardy is my senator, one of my senators, and I have been studying, engaging with, fascinated by the legislative process for a long time. I served in the legislature for 14 years and played a leadership role in the Human Services Committee for 6 years and a leadership role in the Healthcare Committee for 4 years. So the stuff you guys focus on is stuff that is near and dear to my heart. I am trained as a social worker. I work for a law firm, but I'm trained as a social worker at MSW and spent 27 years doing early childhood home visiting in Madison County. So that's kind of my first love.
Yeah.
Is the human service world and working with families that need support. But now I find myself in this very cool role of healthcare advocate. And I'm going to spend a little time talking about who we are and what we do. But I really wanted to start with sort of a more personal. I love this process. It's incredibly frustrating. I mean, I've had some of my most joyous days, aside from delivery of babies being born. Some of my most joyous professional days in this building, and some of my most frustrating, tearful days in this building. So I wish upon you only the good ones, right? I have a presentation I'm going to go through, but I also wanted to, I did not send this to Alex, but I will if you want me to. This is a cheat sheet that we produce. It is it has on it every single program that Medicaid, that the state offers, the Medicaid agreement care programs, and eligibility for it in shorthand, because it has to fit all on 2 sides, 1 page. And so,
I have one question. You said you work for a law firm or you have worked for a law firm?
So I think we're going to have to start at the beginning, and just FYI for you, we're going to try and finish it about 10 minutes up because there's some folks who need to get places. So you've got
15 minutes, is that?
one minute, but let me do it.
No, this is great.
So, let me do the presentation.
Okay.
I'll answer that question. Before I go on, I also did not send you, but I'm happy to send you. We do a quarterly report. We also do an annual report, but the quarterly report goes into more detail. I didn't make copies of this. I'm happy to, if you if you want more information about the work of our office, let me know, and I'll get this to you, and I'm happy to send it to.
You can send electronically to Alex and he can post it under your name. That would be really very helpful.
Am I presenting?
You are.
So, the first thing to recognize is today is not January 11th, January 19th. I did this presentation the other day in House Healthcare stuff. So I'm going to spend just a little time talking about who my team is, who we are, and how we come to do the work we do. And heads up, the presentation is longer than I will get to today. There's a couple of slides at the end about the legislative priorities we have for the year that I think it may make sense for me to just sort of introduce some concepts here, but not go further into detail. And hopefully I'll have a chance to. So there's a picture of us on top of Snake Mountain. So the HCA, the Healthcare Advocates Office, is a part of Vermont Legal Aid. So I've worked for them. We are fully funded by state dollars, state and federal dollars that flow through the state in a single grant. We're a line item in the budget, and through an RFP process, Legal Aid has had the contract since '98. Started. But it's really important. People sometimes think we're an insurance company. Sometimes people think we're part of the state. We're not. We're independent, and we see ourselves as a bit of a watchdog. We're a consumer advocate watchdog, trying to, well, with the stated goal of improving access to care, helping people get the healthcare they need. Did I say 98? 98. 1998 was when the first grant went out. And there's a reference to the statute. Our duties are defined in statute. So we have two teams. One of them is a policy team. And we have a couple of attorneys and a couple of public policy people and a communications person. Is this not big enough?
Wow, that's awesome. That's good. I could read it, but it was, it was getting in the way of listening.
The policy team is, we show up, we have a responsibility to speak on behalf of Vermonters anytime there's decisions being made. Often that is in front of the Green Mountain Care Board. We are there arguing on behalf of Vermonters when an insurance company wants to raise their rates, when a hospital wants to increase its rates. But also in other parts of state government, we find ourselves in front of boards and whatnot that you maybe haven't even heard of. Like, for instance, this is years ago, but the DERB. Has anyone heard of the DERB? Sheila might not know the DERB, the Drug Utilization Review Board. It's a board that informs Medicaid about what to cover and what not to
I've
cover.
never heard it called the DERB.
So it's sort of a statement that we go wherever decisions are. That was about whether Medicaid would fund, would allow for the treatment of hepatitis C. So a number of years ago, we did a big project on that. At the time, Medicaid was only funding hep C treatment after people had cirrhosis of the liver. We thought that didn't make sense. Probably treat them before they have liver failure. That's ancient news. Medicaid's doing a great job on that. We still have concerns about corrections on that. There still continues to be concerns about corrections around that issue, but no. And then we also have an advocacy team that I'll speak more about. But I think if you look at shops like mine around the country, you'll find great advocacy teams. New York, Massachusetts, great shops that are advising people. And you'll find great policy shops that are, engaging in sort of fixing problems in their state's healthcare systems. I think we're a bit unusual in that we're both. And though the day-to-day of the two teams is really different, the advocacy team's on the phone, talking to Vermonters who are struggling, something's not working for, and the policy team is writing briefs and commenting on rules and whatnot. We are best when we inform each other, when the two teams inform each other. And so, and there's something that happens in healthcare policy wonk world that I want to speak to. It's easy for healthcare policy wonks. Welcome to the club. You are now joining this club, Policy Wonk. It's easy for us to forget about how it affects people. It's somehow easy to start to think about sort of it as a policy that's somehow separate. And so the great thing about my setup, and it's a great thing and a hard thing, honestly, is I've got this whole team of people who are talking to Vermonters every day, and they tap me on the shoulder, metaphorically in remote world, and say, let me tell you how this hurts people. Let me tell you how this policy is really playing out on the ground. I've got a case I want to tell you about that. So.
Can we ask questions as we go? Okay.
Please.
I just have a very general question, but I feel as though our healthcare system in this country is fairly unique globally.
Mhm.
Is your work, what you do you find that also to be fairly unique, or do other countries have an organization and a watchdog?
I have no idea
Okay.
the answer to your question. I mean, it does bring me back a couple steps to, I said that we started in '98. That's sort of true. We did start in '98, but we started, the healthcare ombudsman's office started in '98. And in 11, I think, or 12, I can't now remember, we got turned into the advocate's office with a real update in our statute. That was at the same time that we were trying to launch government financed healthcare. And part of the concept at the time was the public needs a really fierce advocate in a public system. Because if the public is making decisions, I don't want to go all the way down this rabbit hole.
Right.
However we pay for healthcare, it's easy for people to get left out, and
Good point. Yep.
I hope so. To shrink it before it goes. So a little bit about the advocacy team. 8 advocates. Like I say, they are fielding calls. We are doing at this time about 1,000 calls a month, and 1,000 cases, a month. Calling the case is not exactly the same thing. Sort of areas of work. And there's 8 advocates, and we are sort of addressing these kinds of things. I want to note that our case numbers are just a little bit lower at the moment because Medicaid is not doing redeterminations. So we're helping plenty of people with applications for Medicaid programs, but we are not seeing the same number that we usually see, that I believe we'll see, or I'm afraid we'll see when we start doing redeterminations.
And we did hear from AHS that redetermination has been sort of put on hiatus, so.
Okay.
I'll come back to that in a minute.
Yeah,
We might
please.
need an explanation on that.
So I thought it would be kind of fun. I'm going to come back to it right now.
Oh, good, please.
I thought it might be kind of fun to give you a couple of cases, tell you a couple of examples, and sort of ask your thoughts about what might be going on. It's a little bit of a test.
Uh-oh.
Okay. Marcia called us. Marcia is a recent college graduate. She's currently on Medicaid. She started a new job where she'll be making $33,975. Senator Lyons is looking at the chart. That's 250% the federal poverty level per year. She has an offer of employer insurance at her new job. So she calls us up and she says, what should I do? And thoughts?
Am I allowed to comment? Keep going. Many questions for me to ask.
So yes, Marcia's over income for Medicaid, but because of the public health emergency, she can stay on her Medicaid program. And we would advise should stay on her Medicaid program until she gets a closure letter. In the meantime, we would encourage her to call Vermont Health Connect to make sure they had her information so that when Medicaid closes, she'll get a special enrollment period and be able to join her employer-sponsored insurance. Yes, we have not been doing redeterminations for Medicaid, and I'm sure Medicaid will come in and tell you sort of the gory details of that, but it's been a long time now. And so that means that there's 200-ish thousand Vermonters on Medicaid programs who in regular times would be used to every year getting a, hey, it's time to redetermine. Just make sure that you still know the parameters of your family and if you're still income eligible. Normal course of events. But people aren't used to that. And so we will be starting it back up. And it's a big lift. It's a big lift for Medicaid. It's going to be a big lift for my office. And I also am really afraid it's going to be a big lift and a challenge for many Vermont families who aren't used to this regular redetermination process, maybe haven't told Medicaid where they live now. And so.
Yeah.
Are you just curious, are you giving her this advice based on financial incentive, quality of care, administrative burden? What's the determination on that decision?
I mean, so the honest truth is that we would be advising her about the rules. Here are your options. Here are the rules. Here are the rules of the game as they apply to you. There's the rule for Medicaid is that you get to stay on, and here's what that costs you. And here's the rules of the game. She could ask Medicaid to take her off and sign up for her employer sponsored if she chose. Yeah.
Where are you located?
Ah,
A family member of mine just contacted. What that area is.
So the helpline that we're talking about is based out of the Burlington office on North Winooski Avenue in Burlington. But we're a helpline, we're a phone line. We serve the whole state. But let me answer another. But Legal Aid has 5 offices around the state. And they are in Rutland and in Springfield and in St. Johnsbury and in Montpelier and in Burlington. So there are physical offices that people can walk into. We have often challenged ourselves about not being further south than Springfield, Rutland. But that's the current structure. And the policy team operates out of the Montpelier office for the most part. Actually, one in Rutland.
And you're located up on East State Street in the corner of College, is it Avenue or Street, one of those?
Yeah.
Yeah, so just go through town, and you go up the hill and it's at the corner at the top.
Okay, Alicia and David make $86,000 per year. Alicia has an offer of health insurance through her employer. Alicia's coverage for only herself costs 6% of her income. But health insurance for her whole family costs 17% of her household's annual income. Given that it costs 17%, can Alicia and can Alicia's family sign up for Vermont Health Connect with a premium tax credit? and I'll just keep going.
Keep going, it's above our pay
This one
grade.
is
We need
stupid
her.
complicated, but, so this is referred to as the family glitch. And with good news, family glitch is fixed. Last year, we would be saying, I'm sorry to the rest of this family, you're kind of out of luck. Yeah, well, I think the Feds played a hand.
Yeah.
We, before the fix that happened this summer, sometime, the rest of her family would be out of luck because of what was called the family glitch. And I'm not gonna go into more detail about it other than to say it's fixed. At least family can now get support through Vermont Healthcare. Okay. Cecilia is in the United States on a work visa, H-2A work visa. She makes $3,000 per month. She recently found out that she's pregnant and wants to know more about her insurance options. Can she sign up for Dr. Dinosaur? So the answer is yes, because she has a legal status. And because Dr. Dinosaur has a legal status. And so, so she's able to sign up, but it sort of opens up the door that to sort of recognize some work that this committee did 2 years ago with what is
Undocumented.
now called the Immigrant Health Insurance Plan. So the legislature passed a bill a number of years ago, an act that created a program that covers pregnancies and children without regard to immigration status. So if the family's low enough income, we're gonna cover the kids in a Medicaid-like program, state funded.
So she's legal and she makes less than the threshold amount for Dr. Dinosaur. Got it. Okay.
Yes, those two things. Before July 1st of this year, we were sort of piecing things together, but she wouldn't have been eligible for this program. So that's sort of a taste of the kind of things that the advocates deal with. Get calls come in every day, lots of them. I watch them come in, and my team does the best they can.
So if you had a call in from someone who's caring for a child or an adult with disabilities at home, and they felt that the benefits they were getting had declined or were being declined, do you deal with that as well? And act as intermediary with the agency? How does that roll?
So because you said disability, so Legal Aid has a number of projects. Are we coming in? Is Rachel?
Yeah, she's coming in next week, and I just wanted you to.
Yeah.
set
So
aside,
the Healthcare Advocates Office is one of the projects at Vermont Legal Aid. There is also a disability law project. And so depending on the nature of what was going on, it might be that the HCA still handles health insurance for people who are disabled, but it might be a case that would be best worked through the disability law project.
Okay, so it's the juggle.
You're going to hear us say this again next week when we come in, but constituent service. I want to be honest. The person who comes to me through the chair of your committee, we really seek to give the same care that we give to the person who calls our helpline.
Yeah.
But there's something about the people who come to us through their legislators that's different. They are often just a little bit more desperate and a little bit more frustrated, a little bit less aware of the landscape of services. And so you're gonna hear me, I think I already have, but you're gonna hear me say, hey, help me reach your constituents. And I gotta be honest, I do wanna support you in doing good constituent service, and I want your help reaching people in your communities. People often ask me questions about how often something happens, and I have to say, the healthcare advocates, we keep a lot of data on our work. We provide a little bit of a canary in the coal mine-like lens about a particular problem. But I always ask myself, how many people, let's say, how often does somebody get turned away from the pharmacy counter without their meds? You might ask me that question, and I might be able to say, we had, 17 cases last month, whatever, some number of cases last month that was like that. But of the universe of people who have that problem, how many know to call my office? Small. I think it's small. And I'm always trying to get the word out about us. And I can't get the word out about us because we would be overwhelmed if, just to use that example, if you ask at a pharmacy counter, how often does this happen? I think any pharmacy counter anywhere in the state, they would say every day. And that's an urgent case. Hey, a clinician said you need this medication. And someone goes up and says, I thought I was going to be paying $3 for it, and it's $63. I can't. And pharmacists do tremendous work in helping people get access to care. But there's some eligibility things that are beyond them, and we work with pharmacies on that. But I mean to say, as an example, there's a lot more need, direct access to care needs that happens in our healthcare system than we really get served.
You know where they are, just past Starbucks, North Main Street. Good place to go.
Oh,
They know it.
So if there's no other questions about us and who we are, I'm going to jump to, there are two policies.
Sorry, I actually do have a follow-up question. So you get the call from the person who can't pay the $63 for the prescription. How do you fix that problem?
I gave a little hint. When I said they thought it was going to be $3 and it turned out to be $62. Medicaid copays for prescription drugs are $1, $2, or $3. And so probably what's going on in that case is the person was on a prescription drugs program and fell off it for some reason.
Okay.
And so in answer, we would work to get the person enrolled in any programs that would help them. It leads me to a point that I think is important. Sometimes legislators ask me, when should I call the commissioner and when should I call your office? And it's a great question because you guys have access to the commissioner. And hey, we should use that access to support your constituents for sure. But the commissioner's job and the healthcare advocate's job is a bit different. So if someone calls you up and says, Medicaid messed up, they think my income is this, but my income is really that, I should get this program, but Medicaid made a mistake. And so you call the commissioner and you say, hey, my constituent says this, and the commissioner says, I'll look into it. Now, the commissioner's job is to make sure that her staff did not follow the rules. And so let's say the staff, the right determination was made. The person's income was counted correctly. So then the commissioner calls her back up and says, no, I'm sorry, or calls the person up. My staff is there to try and help people get the care they need. So in that same scenario, we might say, it didn't make a mistake. This is really your income. But let's look at the other, but maybe Medicaid made another mistake. Maybe they didn't notice you correctly when they were closing you. Maybe they made another mistake. We're going to argue in any way we can to try and help someone get the care they need, or look for other programs that might be available to them.
So we should call you first.
Uh, um,
Short answer.
Yeah, I mean, I think there's probably details when it makes, there's probably details when it feels like the state has made some kind of gross error or something where really, you really want to talk, you want to get the state's perspective. But I think it also makes sense to call us because we're a different kind of advocate for
You get used to the type of issue and question and then you'll make that call yourself. I mean, you really will get to the point where you understand what the problem is. If it's a question of, I just need health insurance, or am I eligible for Dr. Dinosaur? If I'm eligible, am I eligible for Dr. Dinosaur? Probably go either way. But if it's I'm on Dr. Dinosaur, I'm being denied, then I mean, you can decide you want to talk with the agency, or maybe you want the individual to talk directly with the healthcare advocate.
And you know, often people, they don't know what's wrong, it's just not working.
Yeah.
Something's amiss. Yeah. And, you know, it can be something like, man, I had one just the other day, it can be something like, my provider says my son needs this procedure, my insurance company says it's not covered. My provider says it's the only thing that, you know, like there's that kind of a conflict. And my guys are in the thick of those kinds of disputes all, you know, every day.
Yeah, okay.
Just so going back a few minutes to your comment about the slight hesitancy to expand your advocacy to, but if not you, who?
Yeah.
And my first impression would be that the clinicians there, and they're giving the bad news about, okay, so there's a discrepancy, there's some issue, and it is $63 now versus, you know, what the patient may think it is. So what would inhibit your office from having at nearly every site a QR code or a brochure, something to that effect? It says, hey, look, you know, we'll handle the initial question. And then, you know, as a pure.
So you're absolutely right, that our information should be at every pharmacy counter. And we've done some sort of warm handoff relationships. We did it with Kinney's for a couple of years. We're now talking about doing it with the independents. My point is, though, that we are funded at, I think it's 1.8 million by office. I will be looking on Friday to see whether we're fully funded this year. And the governor's recommend. But last year, thank you, this committee supported. We got an increase in our funding because we hadn't had an increase in 6 years. And we also got an additional staff person over on the policy team. My point is that to use that example, people being turned away from the pharmacy counter, if we were to really try and do that statewide, we would need much more than our 8 advocates. I'd be in here asking for more money. And I've decided, thank you very much for the increase in our funding last year. I'm not asking for more money this year. I'm just being honest with you about the lay of the land.
Okay, you're the first one to say that, so that's good.
First one, legal aid is asking for more money.
Oh, I
so
sure.
just to help your advocates. Not yes.
Go ahead, Senator Williams and Senator.
I'm just gonna-
Okay.
Well, I just wanted to reiterate that just legal aid in general, including that healthcare advocate's office, is really helpful, especially when you get constituents who have problems that you're not really sure how to solve, you know, or you just don't have the expertise or the time or whatever. So they're really, really helpful. And there also are really helpful online resources, both on their website, but also there's a sort of eligibility calculator on DEPA's website. It's really helpful to send people to if
thinking, they're wondering if they're eligible
Yeah.
and other things like that. So I often will send people those resources in addition to saying, here's the healthcare advocate's office number or whatever. I did, just as you were speaking, got an email about promoting the jobs you have that you're advertising. You have openings, and it came from Susanna Davis's office saying, please spread the word.
Okay.
So
We're
you're hiring.
filling a vacancy. We had somebody retire. We're filling a vacancy on my advocacy team.
Senator Williams, did you have a question?
So just, say, but what I would normally say to a constituent is, I don't know, but I'll find out.
Mhm.
Probably the first place I would call would be.
Yeah, I think that makes sense. I'm gonna make sure not live streamed. I'm gonna make sure you have my cell phone. I think it's always fine for you to call or text or email and say, hey, here's the kind of thing that's going on. What do you think? And I'm happy to say, and if it's our case, I'll say, great, get permission from the constituent to refer the case, their situation to us, and we'll reach out to them. Simple as that. We want to make it.
Fix it down here. We don't need to try to get to this one.
Right. We want it as easy an access as can be. The only thing is we don't want to call somebody and have them say, why are you calling? So we ask legislators to make sure that the referral's okay. Okay, last year, so two on a very high level, policy issues that we're going to be talking about this session. I said earlier that the legislature passed the IHIP program for children pregnancies. It's been up and running since July 1st. And we are going to be hoping to talk about and encouraging bills to expand, to add adults to the IHIP program. That discussion will require, there will be a appropriations dynamic to this bill. It's a state-funded program. As a reference, the children and pregnancies was estimated to cost $1.3 million annually. I think it'd be good, if you guys want to take this up, or it might be good anyway to get an update from the administration on how it's going. We're only half a year into it, but how it's going, and but we're going to be promoting expanding. And then the next issue is very hard for me to talk about without going way down a rabbit hole that I don't want to go into. But when we look at the landscape of access to care problems, a glaring red light, a glaring problem is low-income people on Medicare. The supports that we have for under 65-year-olds, I would argue, is really substantial, all the way up to 150% of the federal poverty level.
Can you expand that,
Oh, yeah.
image so that we can see what your message is?
There is a whole set of Vermonters who, happy birthday, you just turned 65, find out that they've lost access to care, that they really can no longer afford the care they need. And these are very low income.
Is that because of their inability to pay for their Part C or Part D or their co-payment? Yeah, so
All of the above.
all of the above.
And I'm going to try and stay on a high enough level. Let's just talk for a minute about co-payments, not premiums. For a family of two, Ginny or Senator, can you just tell me what family of two, oh, it's right here in this chart.
What do you mean?
Family of two, so family took $18,300. $18,310 a year of income. Let's just say that again. $18,000 a year of income for a family of two, 100% of the federal poverty level. I don't know how they're living. I just want to be really clear.
And with inflation right now, I mean, I think it's a little different. It's gone up, but it's still gone up insufficient to meet the
Yeah.
inflationary pressures. So
So that family, just above that level, gets all kinds of supports for Medicare premiums, but is left exposed for the 20% cost share. So they have even a modest healthcare need. They're not going to be able to pay the bill. And so we're going to be promoting, increasing the level of the Medicare savings plan that supports cost sharing up to 150% of the federal poverty level. This is not a small lift. This is a very big lift. I would estimate that it is in the $130 million a year range. Yes.
It's a big lift. Is there someone calculating the savings in terms of visits to ERs, et cetera, et cetera? Okay, good.
But is there someone calculating? Oh, I think
I hope so.
but your question is on target. What happens to these people today? And so a couple things happen. One of them is that every hospital in Vermont has a free care policy that will cover their costs. So that means their costs go to the bottom line of the hospital and is then translated into all of our rates.
Right.
We're proposing that we increase a Medicaid program with a federal match to meet this need instead. So there's some logic to why not draw down the federal dollars. But the other thing that I think is really important, we talked to a lot of people with medical debt, with bills they can't pay in the healthcare sector. And I just, Vermonters are, so many Vermonters are so proud and so independent, and they don't want, many hospitals call it a charity program, call it a charity care. And so we talk to Vermonters every day, and I'm sure you guys know them, who say, I already owe my hospital some money, or I already owe my provider some money, and maybe my healthcare ailment will just go away. And that's exactly, we don't want people to have financial barriers to care. We don't.
And we did do something with medical debt last year.
So what you did last year is thank you, it's a really important bill. It creates a statewide standard so that different hospitals have the same minimum standard of free care. And we fixed a number of problems about how it's calculated and whatnot. But we have found there are hospitals doing really a great job. I recognize that there are two people from Rutland. I think Rutland Hospital has had some of the more generous financial eligibility for its free care policies. I won't mention the other side. There's some hospitals with really, really poor ones. So we were looking for a improvement across the system, but we didn't go all the way up to where Rutland was. Part of, just as an FYI, part of the negotiation with the hospital association for that bill was to postpone the implementation date a little while in order to get a little bit more generous number. And so that bill does not go into effect until July 24.
Okay. Well, I think it was one. I thought it was December, but no, you're right.
Yeah. So there's more slides here. I'm going to stop. I'm happy to talk one-on-one with anybody about this or anything else out there.
Well, given that you have specific priorities that you're advocating for, based on input from boots on the ground, people out in communities, are all of those listed on your PowerPoint, or can you get us a simple one-pager bullet? Can we get that? Because it's very informative as we
Yeah.
get bills and we start talking about what it is we can or we can't do. It's really an important
So
reference.
it is really just these two, the expansion of the IHIP program and the expansion of the MSP.
Yep.
Medicare Savings Plan programs. You'll see us on many other issues with more, we have prescription drug, there's other details that will weigh in on. But these are the two major pushes that we're,
That's good to know. Thanks.
yeah, and yes, we'll have one pagers for them.
Perfect. Questions, final questions and thoughts? Thank you. This has been very helpful. We're getting to a place where we can actually respond to constituent issues and needs. It's great. And if you have a chance to visit your own local legal aid office, it's a good thing. It's an inspiring thing to do. If you have an issue with one of your constituents, to take it with you. It's great.
Yep.
It's good.
Yeah.
Meet some neat people.
We are still in a blended where people are coming in a couple days a week and working from home a couple days a week, but particularly for the Burlington office, it's just sort of nice to see the space and see.
Yeah.
Wait, are they still on South Winooski?
North Winooski.
North Winooski, yeah. Okay, great. Okay, so let's go offline then, and we'll